Legalization of marijuana here in Ohio has not only led to a boom in sales, Brittany, you've learned that's actually led more people to visit the emergency room.
It has, Mike. Area doctors tell me they're seeing an increase in cannabinoid hyperemesis syndrome cases coming into emergency departments. And despite the condition being medically recognized for the last 20 years, it's a serious condition that's still somewhat of a mystery to the medical community.
You would have to have a heart of stone not to have sympathy for folks who are vomiting and cannot stop vomiting.
Cannabinoid hyperemesis is a symptom of using marijuana daily for a year or more. Symptoms include sharp abdominal pain and nonstop vomiting that can last days, weeks, or even months. Dr. David Stream with the Alcohol and Drug Recovery Center at Cleveland Clinic Lutheran Hospital says Northeast Ohio Emergency Department physicians are seeing a rise in cases.
The emergency medicine docs that I talk to in Northeast Ohio generally all tell me they see this every day.
Cannabinoid hyperemesis was first reported in 2004. Researchers believe if ingesting marijuana daily, it has profound impacts on skin receptors, including a part of the brain that manages body temperature and control of the digestive system. Symptoms can come on gradually with feelings of nausea, abdominal pain, and then repeated vomiting.
Then there is a cyclic vomiting episode where they start vomiting, they cannot stop, it lasts hours to days, maybe even weeks, and then it stops. And it might go away for a day or a week or a little longer, and then without warning, it starts up again.
Stream says the condition is rather difficult to treat and can take a while for symptoms to alleviate. It's impacting people mostly ages 15 to 35.
Most of the most powerful anti-nausea medicines known to modern medicine, things that we use for chemotherapy every day to stop chemotherapy-associated vomiting, post-operative vomiting, generally those don't work in cannabis hyperemesis syndrome.
Doctors recommend to stop ingesting marijuana immediately if diagnosed. Other solutions doctors recommend to alleviate cyclic vomiting specifically for this condition are to take hot showers and use hot pepper cream on the stomach area. Adding heat back to the body is part of that theory that the condition impacts the part of the brain that controls body temperature.
And doctors say frequent cannabis use, of course, can result in addiction. So what sort of trends are they seeing when it comes to people wanting to get help for that?
Stream says he is seeing an increase in people who are seeking help with sobriety and recovery treatment specifically for excessive marijuana use in Northeast Ohio. He says it's easier for people to get high and hide now because of vapes and gummies.